Understanding Procedural Coding, a work text, 4th edition, Chapter 9 and 10, Hemic and Lymphatic Systems, Mediastinum and Diaphragm. Alright, so this presentation, we're going to start with the hemic and lymphatic system. Basically, when we're looking at this system, we are considering or discussing the spleen, the bone marrow, lymph nodes, and lymphatic channels. Those are all included in this system. When you're looking, and I would like to invite you to pull out your coding manual and turn to the section on hemic and lymphatic system. Mine is actually on page 240. It's going to actually follow up behind, I think it was the cardiovascular system. It doesn't even really change large sections, so as soon as you flip over from your cardiovascular system, you will see your hemic and lymphatic system. Upon arriving to that page, what you're going to notice is it starts off with your spleen. So you have procedures on your spleen, and then right after the spleen, you're going to see procedures on your lymphatic channels and your lymph nodes. So it's two major subcategories in this section. Your code range starts from 38100. Now, let's look at some of our procedures here for your spleen. We start with your excision codes. This is where you're going to see your splenectomies. Again, we are discussing our medical terminology. So your splenectomy procedures are located under your excision section, starting with your code 38100. These are separate procedure codes, so we know what that means. You only can code in this section if this procedure is done by itself. All right. Now, what you also will notice is that you have codes differentiated according to it being a total splenectomy or a partial splenectomy. You also realize here that you have a add-on code with 38102, meaning you have to use that code along with another code. From your excision section, you have code your repair of the spleen. You only have one code for your repair. That's your 38115 for splenography. And with this splenography, it will include both partial and total splenectomies with this procedure. So whether no matter how, whether it's with or without, they're going to include that in the code. From there, you have your laparoscopy of the spleen procedure. You have two codes here, one for your surgical laparoscopy, and then you have a 38129 being your unlisted procedure code for your laparoscopy of the spleen. Now, we have to remember here when we're dealing with laparoscopies, your diagnostic is included if you are performing a surgical laparoscopy. But your notation here lets you know that if you're just doing a diagnostic laparoscopy that does not include a surgical, then you're going to need to code 49320, which will be a separate procedure code. All right. Then from there, you have your introduction section under your spleen, and there's only one code there, which is an injection procedure for a splenography. Okay. And then after that, you have a section, a general section. And here it tells you this code starts with your 38204. But it also tells you under your general section that you have codes that reflect the process of preparation and purification of your bone marrow stem cells prior to transplanting and reinfusion. And they are reported once per day, regardless of the quantity of bone marrow stem cells manipulated. All right, so it's a per day, per diem code. Doesn't matter how much manipulation of the bone marrow cells that's being done. And therefore, you see your codes here reflecting that process. Now, you also see them using the term autologous and allogenic bone marrow transplants. If it's an autologous transplant, that means the patient's own marrow is being transplanted. If it's allogenic, that means they are using a donor they're transplanting that bone marrow from a donor. So you need to realize what those things mean. You also have several notations looking at additional codes for different types of other procedures that involve your bone marrow in this section, so you have to notate that as well. All right, from there, we're going to move to procedures for your lymph nodes and your lymphatic channels. You'll see that section. It starts with is written in red to initiate that section. And in there, a lot of times you're going to need to know basically the site of your ducts or nodes to determine which code you need to use or where that procedure is happening at. You have 2 lymphatic ducts, and then you have 4 major lymph nodes: your cervical, submandibular, axillary, and inguinal lymph nodes. And so your section here starts off with your incision procedures on your lymph nodes. So you have under here your lymphangiotomies under your incision. So and then you also see where they have simple and extensive differentiation for your drainage, and then you also have under your lymphangiotomy where you having your suturing and your ligation. You got the different approaches that code is differentiated by the suturing, your ligation, and your ducts. That's your 38380, and then you have to differentiate by whether it's a cervical, thoracic, or abdominal approach. Then we go to your excision section here for your lymph nodes and your lymphatic channel. And I'm not flipping, I'm sorry, moving my slides. You have your excision of your lymph node, starting with your code 38500. And basically, you're going to have biopsies, excisions, and dissection type procedures that fall under this category. And so basically, when you're coding here, you need to know whether they were using an open procedure, were they using a needle, basically how they were performing that procedure. You also, if they indicate a biopsy or a removal, you need to determine whether it was superficial or if it was deep. If it's a superficial biopsy or removal, then they are removing lymph nodes that are close to the surface of the skin. If it is a deep biopsy or removal, then they are removing it. That node is located by or below your muscle tissue, and that's explained to you in your book. So you have to determine those things to code in your excision section. You will also note here under this section they have a lot of notes telling you that you can't assign this code with some other code. So you have to pay attention to those notations as well. When you are looking up procedures from this section in your index, you want to either go to your excision in your index or you go to biopsy in your index to code for the procedures in this section. All right. From there, you have a procedure called a limited lymphadenectomy for staging. This is you have 2 codes under there, your 38562 and your 38564. With your limited lymphadenectomy, you basically need to, they're differentiated by your location or your site, and you see there's either your pelvic and para-aortic, or it is retroperitoneal. Okay. From there, you have your laparoscopy codes for your lymph nodes and lymphatic channels. So that's where they're going to use the laparoscope. And again, the same thing applies here. Either if it's a diagnostic laparoscopy and you also perform a surgical laparoscopy, then you're just going to code for your surgical laparoscopy, which is your 38564. HIM2253C, but you have notation here that if you're just performing a diagnostic laparoscopy, then you would have to use a 49320, which is a separate procedure code. Okay? From there, you go to a section called your radical lymphadenectomy. Alright, so we talked about the limited. So now we're in, we have a radical lymphadenectomy. And basically, under here, when there's a radical procedure, it's going to include all the lymph nodes that they're dissecting and removing, in addition to tissue under the skin. So you have to be able to identify the size of the lymph nodes and the extent of the removal. Also, most of these codes here are unilateral codes, so you also need to pay attention to, if it is a bilateral procedure, then you're going to have to append modifier 50 to your code, which is for bilateral procedures. Then you have some additional procedure codes here. You have your introduction section here, where you have injection procedures and a cannulation procedure under your introduction section. And then you have under your other procedure section, you have an add-on code for intraoperative identification of sentinel lymph nodes. And then you have an unlisted procedure code for your hemic or lymphatic system under your other procedures. That sort of ends your hemic and lymphatic systems section of coding, and then that takes you to, if you see right up under that other procedure, then you see your mediastinum and your diaphragm section, which is a very small section. That's why we're going to include it. Go ahead and include it in this presentation. Now, for your mediastinum and your diaphragm, so your mediastinum is that space in your thoracic cavity behind your sternum and between your two pleural sacs. And then your diaphragm is that dome-shaped muscle that separates your thoracic cavity from your abdominal cavity. So you got this separated between procedures on your mediastinum and procedures on your diaphragm. Now, under your mediastinum, you see you have incision code. This is your mediastinotomy, and you got about approach. You got your cervical approach here and your transthoracic approach. Then you have your excision and resection codes for cyst and tumor. There's two codes there. And then you have a endoscopy procedure for your mediastinum. That would be your mediastinoscopy. That's your 39400. And then you have an unlisted code for your mediastinum procedures. That's your 39499. That closes out your mediastinum section. From there, you have your diaphragm, and you have mostly repair codes here. So you got repairs, and under that section, you got imbrications and resections. And basically, your book helps to explain to you about your imbrication procedure. They basically use that to help put that diaphragm in the correct anatomical position. So they do an incision to draw back your abdominal organs, and then they do what they need to do in there to help pull that back in the correct position. So that's an imbrication. So that consists are your components or your different procedures falling under your repair. And then you have one unlisted procedure code for your diaphragm, your 39599, that's under your other procedure section. This will conclude our presentation on chapters 9 and 10.